It's so much better than it ever has been because of these products.
You want something that works, try this.
It could change your life like it changed mine.
Okay, so I wanted to talk about this for a second because it's interesting. So she's got this on her tattoo, and I wanted to discuss this because obviously there's a punctum. You can see where I kind of drew out that border, and it's going to distort her tattoo, unfortunately, a little bit because of the fact that there's a punctum there, and I want to remove that. So the issue is it's going to distort it, and she's probably going to have this part of this triangle connect to, like, we're going to have to eliminate this white line here, and then this is going to connect to it. But I'm kind of trying to hide it right along the curve of that. So I'm trying to minimize it as much as I can. But now I guess I got my signature in your tattoo. Mm-hmm. That's what it is. So I'm sorry about that. I didn't mean to do that. So I want to remove this punctum because I know that if it's going to recur, which it can sometimes, but it's more likely to recur in those areas because of the fact. And I'm going to go a little bit, actually I can leave that white here because I can go like this and try to just connect it right there. So that's what I'm going to do. Change it up a little bit here. Okay, so you see what I'm doing there. I'm trying to like just minimize as much of the changing of the tattoo as I can. We certainly don't want to change it so that all of a sudden it changes direction suddenly, the lines, because that would be really distracting. So you are still able to actively squeeze stuff out of here if you wanted to, right? Or did it stop? Sometimes they kind of close up on you.
I tried to before, but it wouldn't come out.
Oh,
but
okay.
it still oozed because I could smell it. I was like,
yeah.
Please, no.
I think then I'm going to just need to open it up here and squeeze it out. You okay, right?
Yep.
Okay. I see why she's heading over there now, actually. Christy won't get any of this on her now.
Uh-oh.
Mm-hmm. Now I get it.
Yikes.
It's okay. It's okay if it happens, just part of it, but you know, we try to avoid it, obviously. You okay, right?
Mm-hmm.
Let's see. Do I want to give it a little squeeze? Are you okay?
No,
Oh, she's all excited about it?
I'm sorry.
Sorry you can't watch it. Let me just make sure I can get like the edge of this. Is that the edge right there, or is this the? Oh, I think it's a thin-walled one. Pretty thin-walled. Yeah, I think that's a little cyst. Okay, now I'm gonna squeeze it.
I'm sorry.
She's so excited. Too bad I need to get like a mirror or something. Actually, you know, we did that for a little while, didn't we? Because we had I had the eye thing and then I let people watch. Mm-hmm. Remember that? I did that for like a hot second and then I realized it sucked. It was no good.
Sorry.
I love it. You don't want to see what's coming out right away, right? I'll save it for you. I'll save it all for you because we're freaks like that.
I can't believe this happening. Dr. Sandra Lee is pushing on my shoulder.
That's so cute. I'll collect it because she's got to reach far to get to the table for this. Okay, let me just now numb it a little bit more so you can pause if you want.
Mm-hmm.
Because they don't give you that much detail for the show, so this person's going to know like exactly like, you know, the things that things we do, and maybe even some of the instruments and all that kind of stuff. You're gonna know that this one looks like oatmeal.
I've seen one where it's grits. And
Yes.
There was a recent one where it was like potato salad. I was like, oh no.
Yeah, we had egg salad. Yeah, you might have to think of something for this one. But see, this is a very typical and what is actually kind of sometimes a little bit annoying about some of these cysts is because some of them have like a pretty thin wall, and then it's like hard to get it all the way off, you know, because they tear. Let me see, maybe it won't tear. Maybe it will actually behave. Ooh, it might behave actually. Make sure I'm not hurting you, okay? Because we have more numbing if we need it. I just need to sort of ease it out. You want to lower her a little bit?
No, I'm okay.
All right, Miss long arms. You do have long arms, right? You don't have the pterodactyl arms.
No, that's my mom.
Oh, yeah.
The little T-Rex arms.
Yes. Oh, pterodactyl, not pterodactyl. I meant T-Rex, yes. You okay, right?
Yep.
Actually, she's is behaving. Let's see if I can get that whole sack out if I can. Be nice.
It's not super huge, is it?
It's not too what?
It's not like super like huge. Or
Uh, it's like we're getting out the shower cap now. Do you know what I mean? Like the cap, the sack part.
okay.
We kind of squeeze most of it,
Okay.
and now we're just trying to get out the sack wall, and it's behaving actually. It's a nice one. It's like a little. The problem is when I can't get it out in one, like if I can't get it out in one piece and I have to take little pieces of it, then I am not so sure that I got it all. Do you know what I mean? Because I know that there's a chance it comes back if I don't get it all. You okay, right?
Mm-hmm.
Stuff, girl. So she has a 2-year-old son that probably watches by default because her partner also watches. So I don't know. This kid is already squeezing at these things. I think he learned early.
You learn really early. And he gets giddy about it, like this
He
one.
does?
He touch it and like press on it and just giggle. And I'm like, hey, don't touch that. And he'll just keep going, like keep touching it and press on it. I'm like, oh man. And today I was like, you're not gonna feel it anymore, buddy. Sorry.
He might throw a tantrum, you know.
Maybe.
I had a fellow doctor, a dermatologist, and she had this mole that like really kind of hung off on her neck, and it kind of, I'll have to say, it probably kind of annoyed a lot of us because we know that how easy that is to just take off.
Mm-hmm.
But she wouldn't take it off because her son, when he would nurse, would like rub on it, and she was like, I can't do that to him.
Oh man.
He's gonna be traumatized, you know. So
Yeah.
the first time he might be like, well, what's going on here? Do you know what you should just do is put like a Hershey's Kiss there. So he'll get like a treat. Anyways, he's going for it. And M&M, stick an M&M on there.
Yeah. That reminds me of my partner
I'm a
in the
freak
middle.
for
Her
that.
back, she has a mole that kind of sticks out, and he always
Yes.
reaches for it and tries to like,
Yeah,
Scratch
see,
at
same kind
it.
of thing.
and she's just like, stop.
Yeah,
That hurts.
yeah. This doesn't hurt though, right?
No.
Okay, good. Almost got it all. Okay, that was not bad at all, Missy. I like it. Just checking around it now to make sure that all of it's gone, because that's the issue, is
Yeah.
it's not all gone, then do a fresh one. Sorry, I took yours.
That's what's there.
It's like the hanky trick. Just trying to. You guys are making fun of me. I'm not making fun. You know, she'll like those words. The hanky trick. We're gonna call this the hanky trick cyst. I gotta think of a new name. Unless you have a name you want me to call this.
I would call it the volcano.
The volcano.
Because it would just
like that.
ooze, and I was just like, oh, it's oozing again. Why? So.
So it oozed, huh? Even despite it oozing, it actually looks pretty nice and clean. Because sometimes when things ooze and they kind of scar down, then I'm worried that it kind of can come back.
Okay.
But it's not too bad.
Awesome.
A little space where it was. Let me just double check by looking at the edges here. Looks nice and clean. That's that one area that keeps wanting to do a little still ooze here. Okay, let's put a stitch in there. Okay. And let's try to line all that up again. Mess over there. Sorry. You made a little pile of.
Yeah.
It's okay. I do that all the time.
So I'll get to see the inside, right? What was in there?
Ah, you left it on the table just for you. I did. Let's see if how well we can line this tattoo up here again. You know what you should do? Oh, if you get the tattoo somewhere, you know what? Well, I can't ask you to do this. I can't believe I'm asking someone to do something to the tattoo. But you should, I should write on it, Dr. Lee was here, or DPP was here, and then you could get that tattooed right there.
Oh, yeah, huh.
Just kidding. I'm not telling anyone to get a tattoo. I'm not recommending that, for the record.
Actually, it'll happen.
I was just gonna
It's
say,
gonna
it's
happen.
gonna happen.
It's gonna happen.
Just wait.
If not me later,
Simple.
someone's gonna
Simple,
do it.
yeah.
People love the show. People love watching it. I love watching it. It's amazing to see what comes out of people.
Yeah, these girls were here from the very beginning too, so they saw what happened, and it is weird, huh? I'm sure people ask you guys that too, like what the heck happened? But we also know, like Christy gets it, and actually you yourself get it too, Valerie, because you're a popaholic too. But like Christy's mom especially is like a popaholic. She gets it. One more little stitching in here because this is hard to pull together because there's like a space underneath there.
So does it
You want to
Since
put a
you-
little dressing in there. You're not even push it down.
pull stuff out or squeeze stuff out? Is there like a hole, like a divot?
Usually there is not when we don't actually take out more fat and stuff.
Okay.
Usually it fills in okay because it's not like, because you kind of bounced out a little bit, you know, because of that. So it's kind of compensating for that. You're no longer bouncing, like pulling out.
Okay.
But I'm trying to minimize like it taking, sometimes it can bulge. Yeah, just because I think there was a bounce back. Let's see if I can get it with my little one here, my angle. I just feel like it was hard to get this pulled together because of the tissue underneath. Let me just manipulate it a little bit here. Okay, let me put my new one in. So I'm gonna put in that plastic surgery type stitch here that doesn't give you so much of the hash marks that go across here, and that's also so that we can leave it in for longer because it's kind of a high stress area. You know, when you reach down and pick up your kid or, you know, things like that, you're stretching. I want you to try to minimize that because the scar can stretch a little bit and widen a little bit because of that, because of stretching of it as it's healing. So try to minimize that, especially while the sutures are in.
Mm-hmm.
And you've seen this, if you've seen a lot of videos, you've seen this kind of stitch, and it's very easy to remove. Somebody can remove it for you at home. It's just my girls will go over it, how to remove it. It's just like one stitch, really. You snip one knot, and then the other one. You might put one in the middle too, we'll see. I know it's a high tension area and it does have a little kid that's gonna wanna get picked up. You itchy or something?
No, I'm just
Oh. You're scratching something.
I was moving my shirt over.
Oh, okay. How are your armpits, Valerie?
Okay.
Yeah?
That's pretty good, yeah.
Okay. Sorry, should I not? Nothing happened to her armpits, by the way.
No, it's
For the
fine.
record, okay. Wait, I just think it's a tight area.
Question?
Oh, I guess that was a random question. I don't think about that.
Super.
See how it alters her little. All right, I'm gonna give her some instructions. I'm actually gonna put this top stitch in here, but I'm gonna put individual ones that she's gonna take out. I'm gonna write that on there, like take out those in 7 days. You know what I mean? Take out this top stitches. You can write it down there, you know what I'm trying to say, right?
Yeah.
Take out these individual ones in 7 days, so they don't leave a little hatch mark. Then the other one, she can leave in for longer. But it is something she has to be very careful with, where she just lifts and takes that one out, because you could, if you go too underneath, you're gonna grab the other one. You know, you could accidentally snag that one.
Mm-hmm.
Does that make sense? Yeah, you know what I'm saying. So, I mean, honestly, does she have to? I just don't want her to. She could probably leave that in for. I'm gonna change those to 10 days. Those two little ones to 10 days. You can draw it out.
Okay.
Another one. So that tattoo looks okay. It's not too bad. She still has that white line, and it just distorted. It mainly distorted this one right here. This one as it connects, right? Because it doesn't come to a point. Maybe they could adjust it, huh?
Then on her neck too.
Okay, nothing should be sharp or uncomfortable. I do think we have to, I put a little numbing there, but I have to take it just off, and it's hiding right in her natural crease of her neck here. So that's good. You okay? No, I'm pushing on your neck, but I'm not trying to push on it too hard. You're good, okay. Let us know if anything issues. You can certainly talk.
So is this a cyst too?
Yes, it is. It's a more superficial one, and I think if I just squeezed it out, it would come right back. So I do think we need to put little stitches there.
Okay.
Weird. I don't know that one snip. It's a little bit weird. I don't love that little snip. One of them has been like that. I feel like I've noticed. Nothing hurts, right?
Probably the same one.
Yeah. Probably just used it a lot. Yes, that one. That one looks like you could actually open it for us. You get to do it. I'll let you do it just because you're VIP. That'll make everyone else jealous. Got a little buzzing song again.
Thank you.
Oh, this is not my first surgery today, right? I did another one. I just feel like I just started today. And we have a lot more patients left, I feel like.
We don't.
Okay, good. Was the knot? I feel like I got it. Okay. That would have been my issue. I thought I didn't pull it all the way. Take that little blue. Thank you. One more. I'm putting those deep stitches in that don't come out, that get absorbed over time. That's what I'm doing right now. Okay. Be in like a little. Why you gotta have one in a little nook like this?
Oh, look at all this space.
Just trying to make it a challenge for us.
There's always that one.
What?
There's always that one
Yeah.
keep you on your toes.
Oh, there's some other nooks that I'd rather not be in.
Uh-oh.
This is not the worst nook.
Oh yeah, I saw that episode where that guy had that.
Oh, the testicle? The extra testicle? It's always a testicle.
Yeah, I was
People
like,
bring it up.
what? This is insane.
Okay, so this one, so we're gonna do a 7, a 10, and a 14. You got it?
Oh, you didn't want to do 10?
I'm gonna do, this one I'm gonna leave for 7 days.
Okay.
The other one I'm gonna leave
10
the
and
little
then
sutures on the back, I'm gonna leave for 10 days.
Mm-hmm.
And then so this is 7, 7, 10, and then 14 for the running. So the back is the 2 bigger ones, 10 and 14. Because this one, I think it doesn't need to be as long, and I don't want it to have a low line.
Okay.
And she'll probably want to take some glamour shots with her cysts, so give her a minute to do that.
Can I get one more picture with you just upright?
Sure, we can try to do that too. Okay, there's that one. That's gone. That's
Wow.
nice. She'll take a little picture of that there. This is the opening. There's your little punctum. It's like a little ring. A little ring for you. If you're gonna marry anybody, maybe you want to use that. That'd be a weird thing to do, yes. And this is that cyst, which you're gonna be able. You can cut through later if you want to. Okay, but this is the cyst from your back.
Whoa.
The oatmeal. See, here's the sac. See that?
Wow. No way.
See that thing we were able to tease out right there?
Yikes.
Yeah, just filled with some. That was what they were squeezing under there, and here's some of the contents. But do you want to cut through this, or do you want me to? Do you want to cut it? Yeah, of course you do. It's your only chance. Cut through that thing right there if you want to. Just be careful. This is sharp. You know, it's not that sharp because it's already been cutting through you. But you want me to cut? You want to videotape it? I'll do it for you. Okay, go.
Okay.
Go ahead.
So just.
Yeah, you might want to. Okay, yeah, go ahead.
Oh,
It's all you. So yeah, it might be hard because it's like kind of. Ooh, I'm not even pointing it at the camera. I'm a bad video taker. Here, you want me to hold it down so you can do that? Ooh,
Yeah.
I'm a bad video taker. Okay. Go. Cut.
it's like really hard.
Yes, it's scarred there, but you can
Oh.
see. Yeah, there it is. See?
Oh,
Here's a little give there.
shoot, there's like,
Yeah, that's it.
oh, it's like cutting into like raw chicken.
There, see?
Oh, whoa, no. Ah.
Oh yeah, I
That
forgot
is
it was that here. I'll
insane.
squeeze this in. God,
Oh,
I'm not
wow.
good at videotaping and trying to do it at the same time. Squeeze,
my God.
squeeze.
Oh, shoot. That's scary.
There you go.
Wow.
My little friend. It's under there.
Ugh.
That was the top of it. Actually, we could have done it from the top. See the little opening right there too? Or is that just a little hair? Maybe it's a little hair. All right. Anyway, there you go. There you
Interesting.
go. You can play with it if you want to. Oh, yeah, here.
It's like science.